So IUI is most common technique in fertility treatment for many couples, and it's basically intrauterine insemination, and it's used to help a couple with unexplained infertility or delayed pregnancy for a long time to have a baby without going to advanced procedure like IVF. So this is simply IUI. IUI work pretty easy to understand. The concept of IUI, we need to understand first the physiology. With normal intercourse, what happens in nature is the man injects his sperm in this place, in the vagina, and then it swims up to the tube to fertilize the egg in this place. Most of the sperm inside the vagina will be killed by the vaginal fluid, and some of them may survive and just reach to the neck of the womb, and where they may struggle also to pass from the neck of the womb. It's another chance, so we may lose another reasonable amount of sperm in this place. Only sperm who are capable to pass from the neck of the womb will be swim until it reaches to the fallopian tube. So if we have a problem with the speed of the sperm or with the normal shape of the sperm or anything, possibly it will die in this place, either in the vagina or in the cervix. And here is the importance of intrauterine insemination or IUI. It just helps the sperm to pass from both obstacles here in the vagina and cervix, and we just go by a very thin catheter into this place and then inject the sperm here and allow it to just travel to this short distance to meet the egg in this place. Hence, fertilization will happen. After IUI insemination, there are chances to have a pregnancy, but what we need first to know is what is the odds of IUI to achieve pregnancy. It's quite higher than natural pregnancy conception rate if we will follow it for quite some time. And once we decide to have IUI, so we need first to know that you are having eggs and you have post-tube patent and you have optimal shape of the sperm and numbers to be ready for IUI. Before we put the sperm inside your uterus, we need to do something called sperm wash, and it's actually not wash in turn, but we need to remove the seminal fluid, which is the fluid that the sperm are swim inside it, and take the sperm out of this seminal fluid. This seminal fluid contain many chemicals that can affect your womb or your tubes if we injected it there, same like something called prostaglandin. If we injected it inside the tube, so it can cause some colics and some nausea and some diarrhea. So we wash the sperm, but ideally we separate the sperm from this fluid and then inject it here in the tube. Okay, so they only inject the sperm, not the seminal fluid. This is the first point. Second point, after we inject the sperm, we would like to ask a patient to sleep over it, like for 15 minutes, take some rest, because recently there is a study in the UK between 200 couples who rest for about 15 minutes and the other who hasn't got enough rest after the insemination. And they found that the pregnancy rate is doubled up to 27% in the patient who rested for 15 minutes after the IUI, and only 18% in the couples who haven't rested. So we recommend to just stay for 15 minutes because this could double the pregnancy chance with the IUI. The good candidates for IUI are any couple who has normal ovulation, means she has eggs, any couple who has sperm moving within the optimal or just below the optimal or typical criteria, and a patient with patent tube. These are absolute indication for IUI. So we need to have eggs, we need to have optimal sperm or just beyond the typical range, and we need to have patent tube. Other than this, all the couple can, if they want to try IUI, they can try IUI. Of course, if they have some period of infertility and before decide to move for further investigation or treatment like IVF. Should we try IUI before IVF is a tricky question because it will depend on many factors. The most important of them is the age of the couple, per se, age of woman specifically, if she is above 35 years and she has low ovarian reserve. So it could be prudent not to move to IUI and waste some valuable time in doing IUI and go directly for IVF. And also the duration of the couple, how long they have been trying, if they have been trying for like 2 years or 5 years or 7 years. So these are variable that just would suggest to try something more advanced. If they just are trying for a short period of time and they have a good ovarian reserve and the semen analysis of the male is quite within optimal ranges for IUI, so we can advise to start by IUI first, but it's not mandatory to have IUI before IVF or to do IUI in general, but it could help some couples. It depends on many factors. First of them, how many times you are trying IUI. So if we are trying it for just one time, it couldn't be so successful. By cumulative repetition of the IUI, so if we do it 1, 2, 3 times, so cumulative pregnancy rate could reach up to 20%. If we did it for another 3 trials, so it would be 6 trials, cumulative pregnancy rate could reach up to 40%. Also, the more, it can reach up to 70% by up to 12 trials. But if we can imagine that all these trials cumulatively could just cause like enough amount of money, so we may consider not to do IUI for this long. So this is the first point. The second point, IUI is successful if it's for the right patients and could really help to do it before doing IVF, if we will say. Another point is important, depends on the factors that lead to success of IUI. If in the semen parameters we found that there is abnormal shape of the sperm, so this may not help in the IUI, and the result could came 20% lower than normal shape sperm. So if we find that the sperm parameter in the beginning is abnormal, I will not advise to do IUI. We can just try anything different. There are some tests we can do before IUI to know exactly will it be successful or no, like CAP test for the sperm or CAP score for the sperm. It just checks the function of the sperm, not only the shape of the sperm. And if we find that the CAP score of the sperm is high, so this means that sperm function will be good, so we can proceed with injection of the IUI. If CAP score came low, so we may advise to do another thing else and save the money of the IUI, of course. So this is another parameter. Third parameter, and too many studies in this area, if we did IUI today and then repeated it before ovulation and after ovulation, so like double IUI, will this cause any difference in the pregnancy rate or no? And they bring randomized control trial, couple, they did double stimulation, and couple, they did only one stimulation or IUI. There was no pregnancy difference in the pregnancy rate for both groups. So double or single stimulation before the time of ovulation, no difference in the pregnancy rate, but the most important is to do it at time of ovulation, and this something can increase the success of the IUI. So for the time of ovulation, we need to make sure that we are monitoring the ovulation properly on the scan, because some tests for ovulation at home may not be accurate. So we would like to advise to just monitor the egg and the proper time of ovulation. You can just advise to go for IUI, to know exactly the time for IUI. So this is an important point. Also, either to take a fertility medication if you are trying for IUI, or not to take fertility medication. For patients with unexplained infertility, I would advise to take fertility medication because it can increase the chances from getting pregnancy after IUI. For patients that we know that only the semen test is just beyond or below the typical, or any problem with, sustaining erection or ejaculation itself, so meaning that the woman has no problem with ovulation and has regular periods, so we can go directly with medication for fertility or no medication, no difference in the pregnancy rate at that. We only need the golden egg to have pregnancy, okay? So if we have 2 eggs or 3 eggs, if we took fertility medication this cycle, so it could increase the chances a little bit, but on the other hand, it could increase the rate of multiple pregnancy, which is something most obstetricians will not like. So 1 egg, 2 egg is fair enough for IUI. It's important for us, golden egg and golden sperm, that's all what we need. IUI, to be doing under anesthesia or not to be doing like that, most of it's a quite simple procedure. Most are pain-free, because if you can imagine, it's a very thin catheter just passing from the neck of the womb. We just insert a plastic speculum here, maybe a little discomfort, but most of women tolerate it and just go by this same catheter. Some women, on the other hand, may have problem with the neck of the womb, maybe too narrow, so it may cause some pain and difficulty to pass this catheter from it. So may advise to take some sedation, but this is very rare, like 2 or 3 in 100 maybe. So, but generally no need for anesthesia or IUI.